Hello and welcome to Wise Up with Open Water, your regular dose of wisdom from the open water community. I'm your host, Ken Pasternak, an Open Water founding member as well as a contributor. And I'm happy to welcome Dr. Jay Varma to today's episode, during which we will talk about the potential of AI to transform public health. Dr. Jay Varma is an expert on the prevention and control of diseases, having led epidemic responses, developed global and national policies, and led large-scale programs that have saved hundreds of thousands of lives in China, Southeast Asia, Africa, and the United States. He spent most of his career working as a public health leader for the CDC and has also worked as a professor in the pharmaceutical industry. He's a widely cited researcher and communicator, having published over 180 scientific manuscripts and essays, and having appeared frequently on international, domestic, and local media, including BBC, CNN, NPR, and other major networks such as Open Water. So, welcome, Jay, and thank you so much for joining me. It's an honor to have you here. Really glad to have you as a member and looking forward to this conversation.
Great thing, Ken, and it's also great to hear that Open Water is joining the list of great media companies out there.
That's right. That's the goal. That's the aspiration. So I'd love to open this chat if I could with a little bit of a primer on public health, because I'm not sure everybody sees public health, at least, not nearly as comprehensively as you do, but also, where does it fit in the overall healthcare category?
Great, Ken. Thanks for having me here, and I love having the opportunity to bring people up to speed and understanding about what public health is, because I think anytime people think about health, I think almost inevitably they think about what it means to get a diagnosis, go to the doctor, and get treated for it. But really, that's the end. And in many ways, for people like myself who try to focus on keeping people healthy, your interaction with a healthcare professional is actually what we want to avoid in some ways.
Mm,
So what we define public health is essentially is all of those systems that are in place, that are created by government, that are created by the communities themselves, that essentially work to keep people healthy. Now, some of those may in fact involve how you interact with the healthcare system and things like the vaccines that you get there, but it covers a whole range of things. It covers things like sanitation, who picks up the trash and keeps the waste away from the water that you drink, who makes sure the water is also sanitized and clean when you get it, who keeps your air clean. And so this is broadly speaking what public health is, but it is really a difficult topic because a lot of people, especially until COVID happened, didn't have any idea about the work that I used to do. They used to wonder, well, what is it that you're actually doing? And I would try to explain, well, I work in government and I don't work in a hospital. I try to monitor the health of the population and I try to design policies and programs that keep people healthy.
mm. It's almost like if I'm doing my job right, you're not seeing the work I'm doing because
Well,
people
and
are living their lives.
exactly. And in fact, there's a phrase that a lot of us used to use in CDC, which is that nobody ever thanks you for the disease they never got.
Yeah.
And that's really one of the biggest challenges. And we can hopefully maybe talk at some point about where our dollars go. And very few of our dollars go into public health. And part of that problem is because it's invisible.
Mm,
But the work we do is important. And there's a really like a kind of a parable that we a lot of us like to use to kind of help illustrate the point I was just making about, what public health is, because it can be abstract. And the parable goes kind of something like this, and it's adapted from one I think that was developed for other purposes. But you have a regular medical doctor, a family practice doctor walking through the woods with an epidemiologist, somebody like myself who works on public health. And they come upon a creek, and all of a sudden they see a kid floating down the water screaming for help. They both jump in and drag the kid out of the water, and they're like, oh, thank God we saved this child. Then all of a sudden they see another child and yet another child. And they're both getting in there. They're trying to pull these kids out. But the kids just keep coming down the water stream. And eventually the epidemiologist gets up and walks out of the water. And the doctor turns around and screams at them and says, well, what are you doing? We're trying to save kids' lives here. And the epidemiologist goes, I'm going upstream to figure out who's pushing these kids in the water. And that's what we try to do in public health. People will say, well, you're not really a regular. I mean, I do practice medicine also on the side.
mhm.
But people often say, well, you're not really a real doctor, but we are. We're trying to save lives upstream. We're trying to stop them from falling in the water and ending up in the hands of our healthcare system.
That's great. I really appreciate that. That creative sort of thought piece really gets you thinking. I'd love to maybe talk about some more kind of concrete examples. I've read some of your articles in which you talk about the biggest issues in public health, and you actually started to talk about how AI might be applied to help address them. But I'd love to start with what those issues are in the first place.
Yeah, I mean, I think right now we face a really important crisis, particularly here in the United States, because of COVID.
Mhm.
And the reason I link it to COVID is because before COVID happened, a lot of people had a tremendous amount of trust and faith in public health agencies. They tended to maybe not know about us, but when they did hear about us, it was almost always in a good context. It was like, oh, there's an outbreak, and these guys figured out what it was and pulled something off the shelf. Or these people put in a new program, and now mothers and babies are dying at lower rates during pregnancy. But COVID created this enormous backlash. And we understand why that is, which is essentially that people felt like their lives were being controlled, that they lost agency over. I mean, this is particularly true in places like the United States and other countries that are individualistic. You don't have quite the same backlash in more sort of communitarian societies. And so what that's done is create a number of challenges for public health right now. Number one, there's been a lot of loss of trust. And unfortunately, that trust is weakening because a lot of the people that sell, unfortunately, a lot of snake oils to try to keep people healthy. They're sort of gaining by saying, like, look at those health experts. They told you to hide in your homes and you didn't really have to. So we're facing a loss of trust. We're facing a loss of authority. One of the backlashes against COVID, with whether it was vaccine requirements or testing requirements, has been to remove authority from a lot of public health agencies. And then finally, and probably most importantly, is a loss of funding. And in public health, because it is, we would argue that public health is a market failure, right? There's a reason why we don't ask everybody to hire their own security guards in front of their homes, and we pay for a police force as a community, right? Because we don't feel it is beneficial for every single person to hire their own security guard. It doesn't work that way. But the same thing is true with public health. You need people out there trying to protect everybody's health at the same time. So it's fundamentally relies on government funding. But when government funding is cut because people in political positions have decided that this is not something that the public really cares about or that they want to support, you lose staffing and you lose systems in place. And so one of the reasons I've been thinking a lot about AI is not just because of the power of AI, to actually make our regular work more efficient, but also the possibility that we in public health may have to do a lot more with a lot fewer people. And AI may be uniquely positioned to help in that regard.
Okay, that makes sense. As you're talking there, Jay, I had another kind of analogy pop into my head, which was kind of this national security analogy.
Mhm.
By the time you're in a war, it's a little late to start thinking about national security. But if you're thinking about, right, what are our vulnerabilities in the cyber front? What are our vulnerabilities, bioterrorism? These things. Sounds like public health is that front line in healthcare, just like, thinking about monitoring communications and other things like that are the front lines in national security. I don't know how off base that might feel to you, but it
No,
connected
it
for me.
feels exactly on base, and I'm really glad you pointed that out. Actually, I mean, I've had a little bit of attention. There is a bit of attention in the public health world about what we call the securitization of public health, like
Uh-huh.
calling public health a security entity or a public safety entity. I disagree with that take. I actually think that we are public safety professionals. I think that just as, we support having a police force and a fire, fighting systems, that public health is part of that security apparatus. And personally, I spent a lot of my career, about half of my career was spent overseas for the US government. I was based in Bangkok and in Beijing and in Addis Ababa in Ethiopia, trying to strengthen up disease systems overseas. And what I would do is I would host congressional delegations on an ongoing basis because I was attached to the U.S. embassies. We're funded by the U.S. government. I'm an employee of the U.S. government. We would basically make two arguments. When you get people who are more of the sort of benevolent left-wing side, we would say, hey, we're over here trying to, save babies and children from dying, and we're trying to, improve the standing of the United States. But when I got, usually tend to be more on the right, but also people in the center who are like, well, is this money well spent for the taxpayer? I say, look, we're fighting diseases over here, so you won't have to fight them domestically. And just like we forward deploy our troops and that
Mhm.
we have intelligence officers in all the embassies I worked, we are that other line of intelligence for the other threat, which are these invisible threats of microbes, which, as we saw doing COVID, do even more damage than wars do.
Yeah, during 2020, I think I got to thinking about COVID as the actual alien invasion that we've always made movies about. It was just such a universal thing. And I mean, you've described the challenges of it and the backlash, and we've all been seeing that play out. But you can't deny that it is this unknown force, this invisible force that could take us over very quite unexpectedly unless the things are in place. What I wanted to ask before we get into the whole AI discussion, which you opened up a minute ago, was when you think back to, the many things that you've done prior to COVID, throughout COVID, what would you attribute like big wins to? What would you say, yeah, that was a really successful program. That was a really successful initiative. I'm really proud of that.
Yeah, well, there's actually quite a lot, related to the work that we've done overseas. But as you mentioned, it can be sometimes very hard to quantify, right? Because we have to use sort of modeling estimates and things to actually help figure out what's going on. And I'd like to, if we have time, I'd like to point to two things in particular. The first one is actually going to sound a little bit controversial, but it pulls off of the COVID example. So when I first went to Beijing, it was in 2008, and I was there from 2008 to 2011. And I was part of a small group of US advisors that was selected by the US government and vetted by the Chinese government to actually help the Chinese government strengthen its disease surveillance systems. They were worried that after the SARS epidemic from 2001 to 2003, that they were very far behind the United States, and they actually wanted our help. This is pre Xi Jinping, and there was a lot of interest in collaboration there. And one of my biggest programs there was to try to help them improve their ability to detect a new respiratory virus. We were literally teaching them how to do laboratory testing, how to analyze data, how to monitor hospitals for increases. And I know there was a lot of, people who think, oh, China detected this too late. And I want to actually make the point that China actually detected this relatively quickly and faster than the US did. What do I mean by that? From all of the molecular analysis that we can do, we think that, this spilled over sometime from animals into humans, sometime in the fall or more likely the winter of 2020. And China first started detecting an increase right around Christmas time. So maybe there was a 1 or 2 month lag. We don't know exactly until this was detected. Now, the US knew about this, right? When were the first COVID cases responded to in the United States? Practically speaking, not until March. There was a small detection in Seattle in early February. So we were already told that this is a problem and it might come. And it took us months to actually act on it. And the Chinese actually act on it quicker. So now this gets to your question about, well, what did you do that was a success? I don't think that detection would have happened without the assistance of the US government and the commitment of the Chinese to continue to maintain these systems. I was literally working in central China near the area around Wuhan on that. So I do consider that a big success, even though a lot of people, especially those who think COVID was a bioengineered weapon, would disagree with that. And then the other point I would make is the other successful program that I had that I thought was, when I was the deputy commissioner in New York City, we launched a program to what we call End the AIDS Epidemic. And in this initiative, what we did was we have these incredible tools now. We know that if you treat everybody with HIV with medications, they essentially become non-infectious. And if you treat people at high risk with 1 or 2 medications, like preventive, you might give an oral contraceptive to prevent pregnancy, they prevents them from getting HIV. And so we did a huge initiative that we got money from the mayor and from the city council to basically expand access to these drugs and expand access to testing and treatment. And that brought the number of AIDS cases down in the year 2020 for the first time that we've ever seen that in New York. Ever since AIDS began, the number of AIDS cases had always gone up, and it finally turned the corner. So those, in my mind, are the 2 biggest accomplishments that I've had in my public health career.
Yeah, I mean, those are very impressive. Living proof of the ages-old adage, an ounce of prevention beats a pound of cure, right? We've got to get ahead of these things and make them non-issues before they become issues. And
Yeah.
those are some really, really helpful examples there. So, and in fact, when you were talking about, especially that Beijing example, I was thinking, wow, my brain's beginning to make the connection to technology, specifically AI, and how some of those things could really be enabled and sped up as a result. And actually, you made a very provocative statement in one of your articles. You said, public health experts agree that 5 interventions saved the most lives in the past century: clean water, sanitation, nutrition, vaccines, and antibiotics. I would probably say most people who listen to this podcast would be like, oh yeah, that makes perfect sense. And then you ask the question, will artificial intelligence join that list in the 21st century, helping to avert illness and extend life expectancy? I was like, well, okay, now I'm really intrigued. What are some of the answers that you have to that question right now? What are the areas of development or opportunities in AI for public health?
Yeah, I would say that, this starts from a premise, and this is held by a lot of us who work in public health, which is essentially public health is purchasable. That is, the more you invest in the health of a community, the more you get from it, right? And if you want to pick the longevity of your community, you could actually buy that. Now, there are certain natural limits, right? We don't know how long a human body can survive for, but we can extend life. That's number one. And number two is that we actually already have almost all of the tools we need to accomplish that, right? So that if we spend the right money, we actually have the tools that are out there. So what we do in public health is try to close this gap between what we know with what we actually do. And this is where you start to think about AI. Right now, those gaps are largely filled by humans, right? We
Mhm.
as humans have to go out, we have to assess the health of the population, we have to develop these policies or programs, and then we have to then monitor them in a population to see if they're actually making a difference. So that's what we in public health do is we say, okay, look, there's a food contamination problem. We've identified all these outbreak cases. We're going to change how food is inspected. That's our new policy. We're going to hire a bunch of inspectors and go to stores or go to factories and inspect them. And then we're going to monitor cases of disease. Well, most of this is what you would consider cognitive labor, right? It's the work of the human brain. And what is AI uniquely good at, right? It's uniquely good at synthesizing information, gathering insights incredibly quickly, and also giving you insights that the human brain, one person's human brain, might not ordinarily do. And this is why I think that if appropriately applied and invested with the appropriate safeguards and things, AI could really help us close this gap that we have struggled to between what we know and what we do.
Okay. Okay. So, I mean, in some respect, what it does for a lot of other industries right now, kind of doing the grunt work, but doing it highly with high precision, right? Things that matter, statistical precision, taking all those factors into account, things that would take armies of people, and maybe decades of time, shorter timelines.
Absolutely. I mean, so much of what we do in public health is really the kind of synthesis and analysis of information that we're gathering from the population. So, I have an idealistic vision, and the way I've generally done my work is I like to think what would happen in the ideal world, and then I work my way back to, what's acceptable, what's affordable, what's politically, going to get supported, what's
Uh-huh.
legal, work your way back to reality. But in a dream world, I had this idea that somehow, let's say you employ, 10 we call epidemiologists, people that analyze data for public health and visualize it and develop policies. If you had 10 people, well, with AI, you could probably reduce their workload at least 50%, let's say at a minimum, and that five of them would essentially not really be needed for the work that they're doing right now. So obviously, in the sort of techno world, you say, okay, cut them out, get rid of it and stop paying for them. In my mind, those then become people who can now go out and do the human work that we're often missing in public health, which is going and engaging with communities and trying to make sure to win over people, whether it's my food inspection example, to try to, get factories, other places to make their food safer, to follow their policies, or to educate communities so they actually know what to look for and not look for. So in an ideal world, this is why, AI could be, really powerful. Essentially, it can double the power of our public health workforce, which is what we struggle with all the time. If we do believe public health is purchasable and there's just a gap in how we get there, the tools, what we need is more manpower, and AI is more power, not a
Mm.
man, but an artificial man or
Yeah.
human.
Yeah, no, I really like that because, like you said, in some circles, people think AI equals lost jobs, right? AI equals where does humanity go? And in some sectors, we see that is definitely playing out. I was talking to somebody about the accounting world and how 40% of jobs are going to be lost in accounting. But what I'm hearing from you is in a sector as important as public health and as personal and human as public health, you need an approach that is high touch, but you also need an approach that is high reach. and AI takes care of the high reach so that you can focus on the high touch.
Yeah, excellent, excellent way to put it, Ken, because I think, and getting back, we started this discussion a little bit with COVID and sort of
Yeah.
loss of trust. One of the most important lessons that was learned is the general public wants human messengers, okay, and wants trusted messengers. And I've written an essay, I wrote an essay in The Atlantic, and I think it was in 2021, about the failures of public health. And one of the failures of public health, in my mind, is that it became too technocratic. Like I said, because we're getting so much information and the amount of information is growing exponentially, we hired humans who are expert at analyzing data and making policies from it, but they didn't get better at reaching into the community and engaging people about it and getting their input into it. And so, just as you point out, there is an idealistic world, and now we can talk about the realistic world in a second. There's an idealistic world in which AI could help get epidemiologists out of their chairs
Hmm.
and into the streets where we can actually be that human contact to actually make sure systems change, right? Because systems aren't going to change simply because an AI system well, I hope not, just because this computer tells them to. They're going to change because humans want them to change, and humans tend to rely on other humans to do that convincing.
Yeah. I'm thinking about, Dr. Anthony Fauci. Why? Because he was sort of the single spokesperson. And once people stopped trusting or believing him, what else did we have? We didn't have anything else. And what you're talking about is scaling that ground game a little bit and making those personal connections more plentiful. So first of all, it's heard more often, it's heard more personally in the communities, and you're not relying upon one personality or one person who, if somebody changes their mind on them, you're not all is not lost.
Yeah, absolutely. I learned this actually firsthand during my career. My first really big job, the one that, had a huge budget and huge staff when I used to lead infectious diseases for the city of New York from 2011 to 17. And this was at the tail end of the Great Recession. And we were still having to cut jobs in city government when I moved from China to New York City. And one of the things we had to do is we had to cut down the hours of our STD clinics,
Mm,
our sexual health clinics. And there was a big backlash from the community. And I found myself, because I had been largely trained in this technocratic position up until then, to say, well, look, we can offload those patients onto the regular healthcare system. We don't need a publicly funded clinic. And one of the things I learned through that experience was how wrong I was.
mm,
That in fact, that clinic, while yes, you could theoretically deliver those services through private healthcare facilities and stuff like that, people would eventually find their way to an emergency department. What you were missing was the community connection.
hmm,
And the entire reason we even get funding for our work is because the community sees things that are visible, right? We talked before about invisible threats.
hmm.
If your threats are invisible and the people fighting them are invisible, there's no constituency, right? So you actually needed to do that. And I learned firsthand from myself that I needed to get out of my seat, actually be engaged with the community. And there was always a tension because the pull was always to go back to the office to look at the data and work on the policies and do that intellectual work. And so in a dream world, I imagine us being able to do that. I think the reality, of course, is that public health is going to be cut. And the more things that get automated, we're going to need public. While I would love to say that we're going to be able to do more with less,
Hmm.
the reality is we're going to be doing less with less in the
Yeah.
future. But AI can it maybe hasten, mitigate some of that loss. I mean,
Mm.
that's my realistic scenario. So I painted you the idealistic one. The optimistic one is that, well, maybe we won't really weaken public health as much as it's been weakened by its funding cut because we can replace some of that with AI.
Yeah, it feels like there is a fundamental twist here, and I'm not trying to spin this in any particular way. I'm just thinking, the role of AI here is not to eliminate humans from the equation. It's actually to improve human connections, which are a major driver of momentum in public health. So we're using AI to improve human connections, not to take humans out of the picture, which feels very counter to what some people fear, but it's what we're talking about here.
And there are models where this can be done. I work 2 days a week in a community clinic where I take care of mostly patients with HIV or at risk of HIV, but also general medicine patients. And these tend to be people on public assistance programs. And we just recently got into our electronic medical record system an ambient AI system. So essentially, what it does is it can sit in the background and listen to your conversation and examination of the patient and essentially dictate your note for you.
Mm.
Now, I will confess, I haven't gotten to use it yet because my clinics have been so busy that I haven't had a slow day where I'm like, okay, now I'm going to actually try it out in real time. But there have now been some studies showing how this is improving the efficiency of doctors. And in my mind, it's where we need to be. One of the biggest downsides to medicine and healthcare, if you've been to a doctor, is the doctor is sitting there staring at the computer and not actually looking at you because they have to document and chart things. Well, what if AI is actually going to improve that human connection where you can actually look at the patient and you don't have to worry about the documentation because there's a system in the background? So there is a way to get this done if it can be done thoughtfully and with the highest ideals and in purpose. And we have some models from the health sector, from the what we call the health delivery side, where people are
Mhm.
going to healthcare systems.
Yeah, that is fantastic. You may have just answered my next question, but I'm going to ask it anyway. We've talked a lot of things today. We've talked about public health. We've talked about the big issues in public health. We've talked about reality versus aspiration, and of course, the role of technology, and hopefully bringing those two things closer together. How, if you could sum up kind of your thoughts or your advice for our listeners, the open water community, what are the one or two bullets that you might want us to walk away with?
Yeah, I would say the first and most important thing is to start thinking a little bit more broadly about the health sector. Okay, when people generally think about health, they generally think about what happens in the healthcare system when people are sick and they need care. And they also think about research and discovery, which we haven't really talked about too much. But the other way in which AI is going to potentially transform is by helping us develop new drugs and vaccines at a much faster and effective rate. So the first message I would say to open water people who are working kind of in business or new ideas is try to think a little bit more broadly. Think about what happens upstream, like that example I gave you about don't just be the person trying to help pull kids out of the water faster. Think about ideas where you can prevent them from even falling into the water in the first place. So I'd say that that's the first and most important thing. And I would say that the second most important thing related to that is be a spokesperson in your organizations and in your communities for things that matter to you about public health. And I realize we want to not, take a political slant on the right or the left, but all of us, it doesn't matter what side of the political divide you are on. We like to breathe clean air. We want to drink clean water. We want to eat clean food. So to the extent that you and the open water, people in the open water community are first thinking about business ideas that are upstream, and second of all, being voices and advocates in your organizations and in your communities for the things that we all need to thrive well. I would really love people to think more about that.
I love that. I think that's fantastic because, in my mind, it's one of the principles the open water community has been founded on, where it's using this collective wisdom to make a difference, right? Not just in business. So I appreciate that advice very much. You've given us a tremendous amount today, Jay. What can the community do for you in return?
Well, one of the reasons I joined Open Water was actually on your advice, Ken, was to join because I'm at sort of that middle inflection point in my career and trying to think if I'm working outside of government, what are some ways that I can improve things? And so I've been working on some startup ideas and other things. But what I would really love to get from the open water community is some of this collective wisdom about, if people can also help me brainstorm what are ways in which we can marshal the private sector or private resources to prevent people from getting sick from these diseases. I would love, input and advice from people out there who have creative thoughts on that and also creative thoughts on how things like AI can be applied because so much investment is going into AI, but it's going into the hospital system and it's going to research and development. How can we apply that to prevention? I would love to hear thoughts and ideas from people about that.
That's great. Wonderful invitation. And I know I've seen on the platform there's already been some conversations started in those areas. I do hope they continue. How can open water listeners reach you if they'd like to follow up?
Sure. I have a website. You can find me on, at drjvarma.com. That's my website. But you can also find me on LinkedIn. That's probably the easiest way to do it as well. And I look forward to connecting with people there. I write regularly for Psychology Today. I write for a public health focused news outlet called Health Beat. But I also try to keep pretty active on LinkedIn because I find that to be kind of one of the last very civil social media sites, which serves the purpose I like, which is to have sort of engaging in conversations about how to make our world better.
Exploring issues rather than trading barbs or opinions. Yeah,
Absolutely, without question. Yeah.
that's great. Well, thank you so much, Jay. Appreciate the time. And I look forward to engaging with you on many levels on this topic for many years to come.
Great. Well, thank you very much, Ken, for having me, and even more important, connecting me to the open water community. I really look forward to having this be a fruitful way where we all help each other be better people and better members of our community.
Well said, Jay. Thanks so much. Bye-bye.